Light sleep is when you go to bed. Like so many people, right? They go to sleep, they have two struggles, right? They say one is that they can't fall asleep and they can't stay asleep. And other people, they can fall asleep, but then they wake up and they toss and turn, they can't get back to sleep, right? I think a higher percentage of people, at least that I talk to, it's really more they fall asleep, but they can't stay asleep. Right. So the first stage of sleep is light sleep. And light sleep is basically short-lived. Light sleep is basically, it's just that your body physically is resting. It's recovering physically. And it doesn't take long. It's only like, maybe 15 minutes, a half hour of light sleep that you actually need for your body to recover. So what is the other component of sleep that's so imperative, right? And so then the second stage of sleep is deep sleep, deep sleep. Um, and so what is happening in deep sleep, right? So in deep sleep, what actually is happening, they're saying, is that you're taking the working memory of your day, right, and you're basically solidifying it. Right? You're putting it into, you're taking your active memories from the day and you're solidifying all those memories into a deeper memory, right? So you can have recall of that the next day, right? And in part, that's why you think about people who don't get into deep sleep, right? They have a hard time remembering things to some degree, right? But the real purpose of deep sleep is partly that, is to get into that solidification of memories, right? Then the third stage is your REM, or rapid eye movement, which is also your dream state. Okay, and this is pretty interesting, right? Because what's actually happening in the rapid eye movement or dream states is that you're taking the memories that are being solidified from your deep sleep, right? And you're interconnecting all of those memories, right? You're interconnecting all of those memories. And what that helps you to do is it helps you to define solutions to impenetrable problems, right? So this is fascinating, right? Because a lot of people that I work with, they'll say to me that, when I ask them, they don't volunteer this, but I ask them, but they don't dream, right? And they haven't dreamed for years. And that is not good. That's not healthy. Okay. That's a sign that the body, the brain is not getting into rapid eye movement states during sleep. Right. Which means, again, yeah, that you're not able to take all these memories and and come up with create. It's, there's two things that actually happen. Let me back up, right? So in this dream state, this REM state, is you're taking your memories that are being solidified from your deep sleep, and you're creating this interconnectedness to all of these memories, and you're problem solving is what you're doing. You're problem solving, right? You're washing out irrelevant stuff and you're coming up. So there is two parts, right? There is the one, this part is the creativity part. So in REM, in that dream state, right, is you're becoming creative. Right? And that's why a lot of musicians, they, right, is they write things, and artists do things when they wake up from their dream state and their most, creative state, right? They also say, like, it's kind of like it's not time that heals, all wounds. It's REM sleep that heals all wounds, right? That's when they say when you're having problems, go sleep on it, right? Go sleep on it, right? Because what's really happening is in sleep, when you get into REM dream states, is that you're again, you're becoming creative and you are defining solutions. The other part of dreaming, which is fascinating, is that it's like emotional first aid, right? When you dream, besides solidifying, into finding, the memories of your day and coming up with solutions, during a dream state, REM states, is you wash away adrenaline. Or I shouldn't say you wash away adrenaline, but it's the only time that your brain, or your body, I should say, is not producing adrenaline. So adrenaline is a stress hormone. Right? And we need it. It regulates blood pressure, all kinds of different things, right? But it's the only time during 24 hours that we're not manufacturing adrenaline is when we are in the REM dream state. So what's going on with that? Right? Well, what happens, it shows in science, is that when we're not producing the adrenaline, so it like what we have in memory, our memories are also attached to emotions. And if you think about it, right, is that stronger memories have stronger emotions attached to them. Right? It's just like if you think about a memory when you were a kid, some things that stand out is because there's a strong emotion around that memory, good or bad. Right? That's kind of like what PTSD is, post-traumatic stress disorders. Right? There's a strong emotional event around the memory of it. Okay, so anyway, there is memory and there's emotion. So what happens in this dream state is that because we're not producing adrenaline, is that the brain is able to separate, disassociate the emotion from the memory. So it down regulates the heightened emotion response behind a memory. It allows us then to take that memory and to become more creative with that memory and disassociate from the emotional experience of it. It's why it's so critical. That's why when you work with patients and you're doing all kinds of different things, lifestyle and nutrition and things, and what we do in the office, and somebody starts to say that they're dreaming again, that's exciting. That is a huge breakthrough. Their brain is getting healthier. Okay. And that's what we're, that's a big, 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 big thing. Um, what else am I forgetting to talk about here?
Well, I mean, I still think you haven't touched on the other two biochemical processes that the brain goes through during sleep.
Yeah. That's the other thing too. So, now again, also in our deep sleep state, um,
And then you also didn't finish the fourth phase of the sleep. So, yeah.
let me go back to the, um,
So there's adenosine, which was really fascinating, and there was the cerebral spinal fluid.
how do I go back to the Zoom here? I lost my Zoom,
What are you looking for?
my Zoom picture here. All right. So anyway, I'm gonna open this up.
The little Zoom icon.
Yeah. Sorry for the little interruption.
It's typical.
There's every little hitch when you're going live here. Yeah. So other fascinating things about sleep. Okay, and we'll get to some solutions. I get that. Everybody wants, well, how do I make the changes and improvements? But the other important parts about sleep, outside of the whole, the dream aspect of when you're in deep sleep, is that your body, your brain is actually detoxifying. So here's some fascinating things that I think people don't know, and I can tell you most medical doctors don't even know this, is that your brain is made up of billions of cells called neurons. Neurons are connecting with each other and they communicate through chemical signals like serotonin and dopamine. That's the network, okay? And surrounding these neurons are other types of cells called glia, G-L-I-A, glia cells. Glia cells are immune cells for your brain, and there are 10 times as many glia cells as there are neurons. So literally about 90% of your brain are glia cells and 10% are neurons, which means basically 90% of your brain are immune cells. Your brain is primarily an immune organ. These glia cells are there to protect the brain. So what happens during sleep? Um, there is a new system that was discovered 10 years ago in neuroscience. And what that is, it's a system called the glymphatic system. I'll repeat that. Many of us are familiar with the lymphatic system, right? So the body's lymphatics, right? We have lymph nodes, and the lymphatic system, we all can think about it as your detoxification. It's kind of like your sewer system, right? Your body pushes toxins into the lymphatic system, which washes it down, again, through the liver and the kidneys, and we excrete the toxins out of our bodies. But now science has discovered there's a separate lymphatic system to the brain, and your glia cells dump toxins into the brain's lymphatic system for drainage, and they call it a lymphatic system. This is new research. And now the question is, okay, wow, isn't this kind of cool? So what's actually happening during sleep? Well, it seems that what we're discovering, I shouldn't say discovering, we kind of know, is that during our waking hours, is your brain is producing the energy molecule ATP, which is adenosine triphosphate. All the cells of your body are producing energy, which is adenosine triphosphate. The brain obviously is an incredibly energy producing, energy demanding organ, right? So we produce a lot of adenosine during our active waking hours. And when we get into our deep sleep, is we're able to wash out the adenosine. Okay, so a lot of people will say, well, like, what happens when I just can't get to sleep? I'm desperate to get to sleep. I just really feel fatigued, but I lay down and I can't fall asleep. What's actually happening, right? And what's happening is that the heaviness, the heaviness of the desire to fall asleep is the accumulation of adenosine in your brain. So your brain is desperately trying to wash that out.